Hello everyone, thank you for clicking on my video. I take that you must be interested in the topic of self-care. I'm Satsuki Shinto, people usually call me Suki, and I'm here today to tell you about the perceptions, impact and barriers of self-care practice among trainee counselors on a course that emphasizes self-care. And the topic of this study is the integration of self-care training, perceptions of trainee counselors. Just for an overview of what I'll be talking about today, I'll start by covering the background, then the aims of the study, the methodology, the results, the discussion, the limitations and future research suggestions, and lastly the implications. Jumping into the background, caring for your mental health and well-being has become increasingly globalized with the phrase self-care taking headlines in promoting this movement. Now, what exactly is self-care? Self-care refers to being attuned to your internal and external demands, as well as needs that foster the maintenance of your mental health and well-being. Self-awareness of your physiological, emotional, and cognitive state is crucial in understanding what brings about improvement and stability towards your mental health and well-being. And at the core of it is the consistent engagement in self-care that promotes your personal and professional self. Now, just a little bit more about self-care. I talked earlier about the internal and external needs, which are internal systems, the physical, emotional, and cognitive aspects related to looking after your general health and the processing of feelings and thoughts. And then the external that are more about community, family, and culture, which are more so about your support systems. And looking after those aspects brings benefits such as elevated positive emotions, physical health, self-compassion, and the building of resilience. You might now be thinking, what about the part you start talking about counselors? We're here now. I'm sorry for the wait. The concept of self-care has taken a particularly crucial role in the counseling field. Counselors often experience work-related stresses such as compassion fatigue, vicarious trauma, and emotional exhaustion due to the numerous emotionally challenging situations that they may face during work. Can you think of other work-related stresses that counselors face? Feel free to write them in the comments. So the negative consequences of this affect a counselor's professionalism. Hence, research highlights the importance of self-care practice among counselors. Now, the same cycle of stress applies to trainee counselors who have additional stresses from academic requirements. Trainee counselors are expected to satisfy the demands of placement and coursework, along with personal responsibilities and adjusting to student life. Therefore, research states that trainee counselors find it increasingly hard to manage these demands, with increased pressure to succeed professionally and academically. As a result, they are more prone to burnout, esteem issues, and forming negative coping mechanisms. This affects their conduct in counseling clients that causes disruptions in the therapeutic relationship and therapeutic process. Therefore, self-care plays an important role in alleviating such outcomes. Research shows that self-care acts as a preventative measure towards these work-based stress and cultivating good practice. It is also correlated to successful therapeutic outcomes if the counselor is engaging in self-care. Hence, there is an emphasis on the importance of instilling self-care practice among trainee counselors, as counselors should take care of themselves to have the capacity to take care of others. As a result, the incorporation of self-care emphasis in counseling curriculums and courses has grown in importance. So outlined here are the particular reasons to why self-care is implemented. Firstly, preparing trainee counselors for the demands of the counseling career and the prevention of harm towards the client, and lastly, to alleviate work-related stress. However, despite the integration of self-care within counseling courses, research states that there's no information on how trainee counselors perceive and engage with the information on self-care. They don't know whether self-care information provided has been beneficial for the trainee counselors, and other researchers suggest looking into barriers towards self-care practice among trainee counselors. Therefore, the current research explores the experience, perceptions, and impact on self-care practice among trainee counselors in a course emphasizing self-care. focusing on the perception of trainee counsellors through conducting semi-structured interviews among trainee counsellors from Bangor University to identify themes and patterns around their experiences, perceptions, impacts, motivators, and barriers towards self-care on the course that emphasizes self-care. Moving on to the methodology. The design is an exploratory qualitative research study where data was retrieved through semi-structured interviews. The data was analysed through inductive thematic analysis to identify themes and patterns. 13 participants were recruited from Bangor University. The inclusion criteria include currently residing in the UK, currently pursuing a Master's in Counselling at Bangor University, ages above 18, however in the study we got ages between 22 to 29, a member of a counselling organisation listed on the Professional Standards Authority's accredited register. There are no exclusion criteria for this study. The participants were recruited through convenience and purposeful sampling by sending emails, messages on social media such as the course WhatsApp and Facebook group, through the research portal Sona, and through word of mouth. Just for a brief overview of the procedure of the study, participants signed up through contacting the researchers or signing up through Sona. The participants would then receive an email from the researcher of the information sheet, consent form, and information form. And after a confirmation of their participation, then we'll send us a Teams link where the semi-structured interview will be conducted, which is about 15 to 60 minutes long. And it is important to remind the participants about the recording and the transcriptions that will take place. After the interview is done, researchers will review the transcripts and send them off to the participants for accuracy and approval. And then after getting an approval, we will send the debrief forms. The quality of the research was ensured by the researchers being mindful of any additional prompts that could influence the participants, having 2 researchers present in the interview for safeguarding reasons, and researchers overlooking each other's transcripts for accuracy. The study adheres to the BACP guidelines for ethical research practice, and the approval for the study was received from the Research Ethics and Governance Committee in Bangor University School of Psychology and Sports Science. All data was securely stored in the university's password-protected database. Moving on to the results. Through inductive thematic analysis, 5 overarching themes were identified: the perception of self-care, changes in the perception of self-care due to the course, awareness of self-care emphasis in the course, barriers towards the practice of self-care, and lastly, trainee counsellors' expectations of the course. Now let's go into discussing and looking at each one of them. Perception of self-care is about the knowledge and understanding the participants have of self-care, the various methodologies of self-care, and how they have benefited out of it. The participants' understanding of self-care is about looking after oneself, listening to their needs, restoring themselves, and processing emotions, which aligns with the general conceptual definition of self-care. They mention various different ways they carry out self-care, where, as I mentioned earlier, it falls into those internal and external systems of looking after their physical health by exercising, treating oneself with food, seeking their support systems, and many others. And as some participants mentioned, self-care is flexible and subjective to what brings about stability for one, which research supports, as what brings about relaxation and restoration is perceived differently, explaining the variance and preference in self-care activities carried out by the trainee counsellors. By carrying out self-care, the participants mention how they're more relaxed and are able to prioritize themselves and are better at coping with demands, which as Coleman and their colleagues mention. Engaging in self-care enhances positive emotions that influences the overall well-being as well as outlook towards life. Changes in perception of self-care. This is about how participants have indicated that their perception of self-care has changed after entering the course, and these pertain changes that they see in themselves and how they're exploring more of self-care. Participants mentioned how there have been changes in the various self-care methodologies that they carry out, how some things they did not consider self-care before is now very much self-care to them, and adapting old self-care methods to new environments. A lot of it was centered around learning to take care and prioritize oneself, and how important self-care is for counsellors, which should link back to how the course provided an avenue for knowledge and awareness on self-care where peers and educators provided acceptance and openness about talking about struggles, making it easier to seek for support, which previous studies indicated how trainee counselors have the tendency to hide their struggles as they are afraid to be perceived as incompetent. However, openness and acceptance from peers and educators instills confidence and comfort that becomes a powerful tool to motivate and inspire self-development and in the practice of self-care. Moving on to the awareness of self-care emphasis on the course. The theme is about the awareness and influence of the self-care emphasis on the course, on their self-care practice, where participants indicated that educators have played a crucial role through their constant support, reminders to take care of themselves, PPD groups discussing self-care, suggesting self-care resources like applications, and their openness towards listening and reaching out for help, which has encouraged and motivated their active involvement in self-care. These actually follow, I am really sorry if I butcher this name, but Vincennes and colleagues have made strategies on how educators can effectively encourage self-care practice among trainee counselors to promote consistency and habits of taking care of oneself. These include pastoral systems, mentioning of self-care in lectures, opening discussions about self-care, providing resources, and lastly, reflecting on self-care practices, which some participants mentioned that the weekly journal is a useful tool and reminder to engage in self-care. However, there are mixed responses regarding the emphasis of self-care in the course. Most participants indicated how verbal communication from the educators during workshops, discussions, and lectures promoted their self-care practice, while some participants have not noticed any particular emphasis on self-care. For the participants that have perceived information, some of them have incorporated it into their self-care routine, while some have found other ways to adapt new self-care methodologies to their new environment from the discussions with peers or the readjustment of their old ways of self-care. Research states that it is important for trainee counselors to be able to identify their triggers to diminished self-care and how to repair the damage, which can be learned from the self-care emphasis in a course to explore their practice of self-care, hence explaining how the participants are responding to the information and the material presented. Barriers towards the practice of self-care. The majority of participants mentioned the difficulty in engaging in self-care is due to the time constraint as a result of the intensity and demands of the course. Although most participants mentioned that they engage in some form of self-care at least weekly, they are witnessing a decrease in their practice of self-care as assignments and deadlines near. This is consistent with multiple studies that indicate how demands and responsibilities of the counseling field, concurrently with the academic requirements, cause trainee counselors to find difficulty in time management, often leading to overlooking their needs. Other stresses include financial limitations, weather changes, adjusting to a new culture, and self-criticism decrease the frequency of engaging in self-care. The last theme, trainee counselors' expectations of the course. This section highlights and expresses the trainee counselors' thoughts about the course and what aspects could be improved or incorporated. This acts a bit like the implication, but just moving on. Due to some trainee counselors expressing that there is not enough emphasis on self-care in the course, suggestions of lectures, seminars and workshops on self-care, exposure to different types of self-care, space to provide self-care practice, reduction of demands, practical exploration of self-care, and educators to engage in discussion of how they carry out self-care as professionals in the field would be very beneficial. On the contrary, some participants are content with the information provided and are happy with the current emphasis on self-care in the course, therefore deem there are no improvements needed. However, there are different perceptions towards the emphasis on self-care in the course among participants. This can be due to some students being absent during particular classes and discussions that may have concentrated on self-care. However, it also can be interpreted that there is not enough material and resources for trainee counselors on the course to easily access. Hence, it would be important to take the participants' suggestions into consideration, as a lot of the suggestions align with the strategies recommended by researchers on how to emphasize and promote engagement in self-care. However, there are limitations towards the current study. The trainee counsellors recruited were from one university, which limits the understanding of whether other trainee counsellors in other universities experience and perceive self-care the same way, and whether the course and educators differ in their emphasis on self-care on the course. Another crucial consideration includes the differences in stresses and experiences compared between first-year students and second-year students. The current study had a mix of first-year and second-year students, where their experience with the course requirements and demands is notably different. Given that the study was conducted by the students in the course, and the research is to be evaluated by the educators of the course, the participants may have answered questions in a desirable manner. Therefore, in consideration with the limitations of the study, future research can conduct the study across multiple different universities, consideration in separating data analysis between different cohorts, and a very interesting area would possibly be looking into the educator's perception of the promotion of self-care emphasis on the course to gain insight on how educators are emphasizing self-care in their courses. Let's move on to our implications. The study has brought valuable insight towards how to further support trainee counsellors throughout their training. It emphasizes key elements towards how they can engage in self-care practice and how they perceive the information provided by the course. The participants provided crucial aspects that can enhance and encourage the practice of self-care by suggesting more practical and concrete resources, as well as lectures on self-care to increase their understanding and exploration of self-care. Furthermore, the study highlights what has been beneficial for their self-care practice on the course, along with what makes engagement in self-care difficult. This study will be useful for counselling courses and programs to refer to when structuring their curriculums, as well as for trainee counsellors to grasp further understanding of the field. Additionally, it provides crucial insight and information on student experiences for counsellors and supervisors to refer to. Before we reach the end, this is just a little take-home message. Self-care is incredibly important for counselors to sustain their professional and personal self. So just have a little think about whether you've looked after yourself this week. And if you'd like to, you can comment about how you did look after yourself this week. This brings us to the end of my presentation. Thank you so much for listening to this lengthy video, but I hope it has provided valuable insight towards the importance of self-care for trainee counsellors and how to better support them. If you have any questions, please do ask away in the comments. Thank you.